am a registered dental hygienist, known as an RDH. I see the patients, I do an exam on their teeth to see if there's any cavities, and then we go from there and we clean off any buildup they have, polish off the stains, do fluoride treatments, take x-rays, a little bit of everything. Depending on the day, we see a variety of patients, all different ages, from about 3 years old and up. So if we have children, it's a very different day. It's getting them used to the dentist and getting them acclimated to what we do here. We see new patients as well as patients that have been here for 30 years. So some people are coming back for regular checkups and other ones are just starting out fresh. Sometimes we have emergency patients that are having pain, so we have to see them and diagnose what's going on and figure out a treatment plan. First of all, to be a dental hygienist, you have to go to an accredited college and get at least an associate's degree. My degree is an Associates of Applied Science in Dental Hygiene, and it takes roughly 2 to 3 years because the actual dental classes take 2 years, but a lot of times you have prerequisites that take an extra year and you have to gain acceptance into the program, which can be a little tricky because they really limit the amount of students that they accept. You might have 250 people trying to get into 30 or 40 spots for the year. I went to Allegheny College and they do the 2-year program there. If you go to like WVU, it's a 4-year degree. It's a bachelor's program, and basically the only difference is they focus on you can be like a teacher at a college then. They do a little bit more business aspect, and then you could work as a rep for like Colgate, Crest, companies like that. There's also now a master's program that you can go into for dental hygiene, and they're building. Dentistry's changing, and they're finding that they're not having as many dentists coming out of school as what they need, so they're now making a dental hygiene therapy program, which is kind of the equivalent of a nurse practitioner, where you do like simple fillings and things like that to help with the shortage of dentists. So that's a little bit more schooling. Now, as far as the continuing ed, in Pennsylvania, the rules or the regulations are you have to have 20 continuing ed credits every 2 years and apply for your relicensure. You have to keep your first aid, CPR, all of that up to date too. And now they require your radiology classes to be updated. It's about like every 4 years, and also child abuse classes. Actually, it's the same thing. Probably the most challenging are when you get difficult patients. It could be difficult patients as far as very hard to work on, or they haven't seen a dentist in 20 or 30 years. A lot of times they're afraid, they have anxiety because they had a bad experience as a kid, or all it takes is one time and they suddenly don't like the dentist, so they don't want to come back. Or you get children that are afraid whenever they come. So it's very difficult to get them comfortable, but it's rewarding because usually you can turn it around and they'll end up liking coming back, and you get their mouth fixed up and to where they feel good again, and so it's nice. I actually started helping out Dr. Shook just on an as-needed basis whenever I graduated from college. I had a full-time position, also at another office that was 4 days a week. That's one of the perks of being in dentistry. Dentists don't like to work 5 days, so you usually just have to do a 4-day week. But I would fill in on my days off if his regular hygienist needed a vacation. So over the years, I started adding more and more days of filling in, and a few days a year led to a few weeks a year, which led to a couple months a year of work, and eventually she started cutting back to retire. So I cut back at my full-time job, which was farther away from home, and I started working here like 2 days a week, then 3 days a week, and now I'm here all the time. I would think the most important thing for a dentist when he's looking for someone is to find an employee that is good with the patients, as well as has good skills, because making them comfortable is the biggest thing. But in order to do that, you have to be a good team player. So you want someone that can get along well with people, whether it's the patients or the other staff. If everybody works together, then it makes for a good dentist office, and it makes for the best experience for the patients. But if you don't work together well, I've been in a few offices and it gets really, really tiresome, and it's no fun going to work. And who wants to go to that every day?